Well, the biggest paradigm change from when my father started till now is more preventative dentistry versus reactive dentistry, I guess. Back then, they saw a cavity, was just fill it. Now we have fluoridated water, number one, which helps prevent cavities. A lot of the science now has come along, so we know that the body can actually fix some small cavities. So instead of just doing a filling, we may provide some type of certain toothpaste or mouth rinse to try to remineralize teeth. The materials have changed quite a bit. Back then it was mostly silver fillings, the amalgam fillings that everybody talks about. With those types of fillings, you have to destroy a lot more tooth structure. And now we have composite fillings. We can go just after the decayed part of the tooth, keep it more conservative, and maintain things. Plus, the aesthetic dentistry has gotten out of control with the bleaching and the veneers. You can pretty much change somebody's total appearance.
Understand that dentistry was first practiced in Pakistan way back in 7000 BC, and then the first dental school was opened in the United States of America in 1828 in Bainbridge, Ohio, which I guess is where the dental museum is now.
I wasn't aware of that, Joe, to tell you the truth. I didn't realize it was 7000 BC. That's pretty impressive. I knew there was definitely ancient dentistry. We've definitely come quite a bit of ways from then, though.
Are people taking better care of their teeth today than they did, say, 20 or 25 years ago?
I think people are a little more educated about how to take care of your teeth, and I think that the word has gotten out there through the ADA of what preventative dentistry is and things like that. However, with all the concentrated sugars that are out there and these energy drinks that are out there, we see a lot of younger people that have a lot of decay, especially late teens, the athletes drinking all these sports drinks, and then the college students with the energy drinks. I see quite a bit of problems with that, and we're trying to get the word out that those are not good for your teeth, and you need to cut down on that stuff.
Well, as you know, Mayor Bloomberg in New York City has been very concerned about the soft drinks, and he had a regulation approved by the City Council in New York, all set to take effect. And twice so far, the New York State courts have said you're assuming too much power, Mayor Bloomberg, and that it can't happen. Your thoughts on that?
My thoughts on well, no, I don't. I think that you can't tell people what to do with their body. People have autonomy, and I think he is overstepping his bounds. Obviously, he's trying to protect the public from diabetes. Is a huge problem in this country, and I understand that, and people in the medical field understand that. But you can't. This is the United States. You can't tell people they can't drink a certain size pop. Obviously, as a dentist, I educate my patients. I tell them this is how the decay process works. You should cut down. And at that point, you got to leave it up to the patient or the public. You can't, in this country, you can't cut that and force them to drink smaller beverages.
Well, we have Easter candy. We've got Valentine's candy. I would assume in Dr. Schumer's world that Easter Sunday and Valentine's Day are your two least favorite holidays in the USA as a dentist?
Absolutely not. I've got two children. I'm not going to shelter them and not let them have candy. They have Easter candy, they have Halloween candy, but it's moderation. You got to take things in moderation. My kids brush their teeth, they floss their teeth, and they're not sitting there eating candy 24 hours a day, 7 days a week. But when the holidays come, I'm not going to deny them childhood, so. And I eat candy every once in a while too. I'm human. Everybody's human. So
it's important for people to brush their teeth at least twice a day, right?
Correct. Yep.
What do you recommend how do you recommend someone handle their teeth on a daily basis? Get up, brush first thing in the morning?
Yeah, you want to brush first thing in the morning and right before you go to bed at night. But not only brushing, but the real important thing is flossing. Because what people don't realize is a lot of the bacteria hide in between the teeth. And toothbrushing does not get the bacteria out of there. The bacteria will sit in between the teeth, and then every time you have something with a carbohydrate or a sugar, it makes acid and it dissolves the teeth. And I see most of my decay is between the teeth, and that's because flossing is a problem. A lot of people brush. It's the flossing that's a problem. And then also, without the flossing, you have a higher risk for gum disease, and that's a big problem too, because gum disease doesn't cause pain. Doesn't cause really much symptoms, and when I see people and I tell them you have gum disease, they're like, well, I don't have any pain. And so it's very important, brushing and flossing together. You can't just do one.
Also keeping getting your teeth cleaned on a regular basis from the dentist is important as well.
Absolutely, because again, we want to prevent things from happening. Dentistry is less painful if you catch things early, or prevent things altogether. So seeing your dentist twice a year is very important. Allowing your dentist to take the necessary radiographs is very important.
What's a radiograph?
A radiograph is a dental X-ray. Okay, and a lot of people are very scared about this. They read a lot of things on the internet. In my offices, and I think hopefully most offices now have gone digital. Digital Radiographs have very low radiation, very little exposure, but it's very important for the dentist to be able to see those radiographs, because without it, you can't diagnose gum disease because you can't see the bone, and you can't see those cavities that are in between the teeth. And I have a lot of people that got afraid to get these x-rays because of what things are on the internet, and I want to stress that it's very low dose, and your dentist should take the radiographs on a needed basis. Not everybody needs it at the same interval, but when you need it, you should get it.
Well, in researching for today's show, I came across the fact that many, and I know people that are this way, many people are phobic when it comes to visiting the dentist's office, and you've sort of alluded to that right now. What do you do as a dentist when someone enters your office to make sure that the people feel comfortable, and you try to make it a fun experience instead of a terrifying experience?
Well, especially when I meet a patient for the first time, I don't just jump into the dentistry. I want to talk to the patient a little bit, get to know them, get to know their background. And if they have, most people who are afraid of the dentist have had some type of bad experience, usually as a child,
yes,
and it's caused the phobia. And it happens, and I see that a lot. So I want to find out what happened. Why are they afraid of the dentist? And if you can find that out, and as you talk, just talking to the patient will usually put them at ease. But if you can find out what the problem was and say, hey, we don't do that anymore, or we do this now, or let's take it slow. I usually, if I have any patient that's scared, I'll add an extra 15-20 minutes to my appointments, just so I can take the time to talk to them, go slow, let them know that they're in control and nobody's just going to do something. I think that's the biggest fear, is people don't feel like they have control in the office.
One thing I noticed about your office is, I became your patient about a year ago, and when you walk into your lobby, there is a very friendly atmosphere, and the staff, your support staff there, are very, very friendly, and they seem very focused on making everyone who visits feel right at home, and that makes a big difference. It
makes a huge difference. Right from you walk in the door, you've got to have a relaxed atmosphere, and you want the patient to feel like they're not just the dentist, but they're part of something, and that we want them there, and that that it's not going to be this horrible experience that they had as a child. So it is important.
Now, you've talked about fluoride, and there are some people who are anti-fluoride because they feel that they're taking a medication that they don't want to take. Your thoughts on fluoride? You think it's good for the country? You've alluded to it.
I think it's excellent. There's a lot of information on the internet. Internet can be a good thing and a bad thing, but if you go by the literature, the medical literature, especially the dental literature, fluoride has been proven time after time in the correct dosages, I have to say, to prevent decay. It also chemically, as the body tries to remineralize the teeth, when there is a small cavity, if fluoride is available, the body will chemically change the structure of the tooth and make it more resistant for future acid attack from bacteria. So I think it's absolutely essential. When I moved to this area here, one of the areas we lived in did not have fluoride, which is in the water, which is different from Michigan, because in Michigan, wow, all areas are pretty much fluoridated. So I had to give supplements to my children. That's how strongly I believe.
What municipality is that?
We were in Latham, really? So I don't know exactly where the water came from, but we were told by the pediatrician in that area that it wasn't fluoridated water. I checked with the water company. I can't recall which one it was, but I ended up giving my two children the supplements based on the ADA's recommendation and what I think is needed.
What is oral cavity disease?
Oral cavity disease?
Right.
Well, basically a cavity is a result of the decaying process of the tooth. It's what it sounds like, a cavity. It's an open cavity in the mouth. And that's the lay term for what we would say carious lesion, because the disease in the mouth is actually caries, okay? Mm-hmm. And that's when you have a carious lesion in the tooth, it starts spreading and spreading and spreading, and if it's not taken care of, all of a sudden, the outer shell of the tooth will open up and you'll have the cavity. By that time, it's usually pretty big. If we catch these carious lesions when they're small on the dental x-rays or the radiographs, then it's a lot easier to fix.
You talked about catching them when they're small, and with young kids having so much of the energy drinks or soft drinks now, are they going to dentists as frequently as they should, or is it like, uh-oh?
Well, I think they could go a little more. The ADA recommends your first child's visit either by their first tooth eruption or by 1 year of age, which seems pretty young, but you want to start them off early so that they're used to the dentist, that they're not afraid of the dentist, and they want to keep coming. I think in the area we live in here in the capital region, I think they come pretty often. In my office, I think we see them on a regular basis. But generally in the country, I know that it is an epidemic. Childhood caries is pretty big in the country because I think access to care is a problem.
According to what I was researching on the web, the role of a dentist is to prevent cavities, prevent gingivitis, and prevent bad breath. How do you go about doing that?
Well, brushing and flossing, like we talked about earlier,
right,
is going to be huge for the gingivitis, which is gum disease, which can then turn into a more serious condition, periodontitis, and that's the one that causes bone loss. Cavities or caries, that's again brushing and flossing. Bad breath, a lot of times bad breath is caused by bacteria on the tongue. A lot of people don't realize that you need to brush your tongue. Sure. A lot of the toothbrushes now actually have tongue brushes on the opposite side. Using a tongue brush, getting the bacteria off the tongue is huge. Smoking is another bad breath problem because the more you smoke, you can also get bacteria on the tongue. You get something called coated tongue, where people's tongues can look brown or green and all kinds of colors we won't go into here. But that's causes halitosis or bad breath. Mouth rinses are good for that. Listerine, I like, keeps that bacteria down, and that'll help. But if you still have bad breath, there could be other underlying problems. You could have serious problems, and if you can't get rid of your bad breath, you need to see your dentist.
What type of you just alluded to there are different types of toothbrushes. What type of toothbrush does Dr. Schumer recommend?
I recommend a soft bristle brush because you can the gum tissue around the teeth is very delicate, and a lot of people feel if they scrub really hard that it's better. And that's really false, because you can actually cause your gums to recede away, thus exposing your root surfaces. And you can actually erode away or abrade away your root surfaces by brushing with a hard bristle brush or being too aggressive in your mouth. So soft bristle brush and gently massaging the gums as you clean your teeth, not super scrubbing.
What is gingivitis?
Gingivitis just means inflammation of the gingiva. And what it is everybody's got bacteria in their mouth. If you're not properly brushing and flossing your teeth, this bacteria starts to grow and change. And as the body tries to fight the bacteria, because it's an infection of the gums, it causes the gums to be inflamed. Gums will bleed when you brush, bleed when you floss. Your gums shouldn't bleed when you brush or floss if they're healthy. If the gingivitis is not corrected, because that is pretty correctable, it can be reversed within like 10 days if you start brushing and flossing. If it's not correctable, the bacteria actually change and become more aggressive form of bacteria, and then it starts attacking the body in a much more aggressive manner. And as the body tries to fight that off, it destroys its bone, and you start having bone loss. And then you get something called periodontitis, and that's much more severe, and it causes permanent destruction of the bone supporting the teeth.
And that's when you get that, you should be going to a dentist at least every 3 months to get your teeth cleaned, right?
Yeah.
To monitor that situation.
It depends.
Want to talk about that a little?
Yeah, it depends on when you come into a dentist, they're going to measure your gums, they're going to measure the pocketing, and they're going to look at the radiograph to see the bone loss. If they feel that you have active periodontitis, you will get something usually called a deep cleaning or a scaling and root planing if you're a moderate case. After that, they'll probably put you on a 3-month recall to make sure that it doesn't come active again. If you're very severe, you may have to be referred to a periodontist who specializes in that.
What is the American Dental Association?
What is it? It's an association that basically monitors the dental practice, lobbies for the dental practice, and basically allows dentists to have a say, a large presence in the country. They're a good source for information for both the public and both for the professionals. They're a really good group. I'm definitely a member of the ADA.
Dentists, you can possibly detect AIDS, you can detect osteoporosis, you can detect diabetes. You can detect diseases that people may have, but they're not aware of having?
Well, for instance, diabetes. There's been a clear link now between diabetes and the risk for periodontal disease and the control of the blood sugar. So it's not that dentists can say detect it just by looking and seeing something, oh, you have diabetes, because you can't do that. You still have to run tests at your primary care doctor. But if I have a patient that comes in that's telling me they're brushing and flossing and I see advanced stage periodontal disease, there's got to be, they're most likely something underlying. So in that case, I may say, hey, have you been checked for diabetes? Maybe you should see your primary care doctor. HIV, there's a couple things on the gum that you can see on the gums, or you can see certain lesions in the mouth that would make you think that there's a possibility. So if the patient has these type of lesions and they say, I don't have HIV, I may say, hey, you should go see your primary care doctor and maybe get checked out. Obviously, I'm in no way qualified to diagnose those things. It's not my scope of practice. But if I see something that looks abnormal that is linked, that I know has some type of link to another systemic problem, I would definitely recommend my patients seeing their primary care.